dot, 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 dash, dot, dash, dot, dash, dot, 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 dot. Communication has come a long way since the advent of the modern era. We started off using the Morse code and telegraphs. Soon, we shifted to the telephone, later to binary, and then to email, and then to texting and SMS. Nowadays, we're using video chatting on our mobile devices to talk to each other face to face, even if we're in different geographical locations. Many industries have embraced technology. However, there is one industry in particular that seems to be sticking out like a sore thumb. One industry in particular that is stuck in this Morse code age, and that is the healthcare industry. The healthcare industry, for the vast majority of its processes, still runs on paper records. That's right. One of the biggest industries in the United States and around the world in the 21st century is still using paper records. What a waste. My idea is simple. Let's embrace technology, particularly cloud computing, and shift the healthcare industry to the cloud in one consolidated system. The system could be customizable to city, state, and federal regulations. It's not that hard to do. Most of you are probably familiar with cloud technology if you've ever used Google Drive, Dropbox, or other services. You basically get your files and you dump them on the internet in space. It can be accessed at any time by anyone and any location in the world. It's convenient and it's very, very easy to use. Picture this. You walk in to a healthcare provider's office, meeting a receptionist, who then proceeds to hand you a clipboard. That clipboard has about 14 or 15 sheets of paper on it, filled with questions, most of them easy to answer, but somewhat tedious. What is your name? Flip a page. What allergies do you have? Flip another page. What symptoms do you have? Family history of disease? Past surgeries? Current medications? Etc., etc. You hand back in that clipboard, and moments later, you're met by your healthcare provider, who then proceeds to ask you very similar questions. What's your name? What allergies do you have? What symptoms are you feeling right now? Any medications? Family history? Wait a second. Didn't you just fill out all of that information? Yes, you did. We as humans have one very precious resource in common, and that is time. The truth is that nobody has the time to be filling out all that monotonous paperwork. Nobody has the time to be reading all that paperwork, especially a healthcare provider who is busy treating patients day in and day out. And nobody has the time to be filing away your paper records in a dusty filing cabinet in the back of some office. I hate it. I hate this system that we have right now. But I'm not going to keep on hampering how terrible it is, even though I personally hate it. Not too long ago, the American Recovery and Reinvestment Act was passed by the U.S. government, making it mandatory for all public and private practices to implement EMR, electronic medical records. That's great, but the vast majority of practitioners that I have personally talked to don't like it. They say that current EMR systems are clunky, hard to use, inefficient, vulnerable, and just not good. So what can we do? We can first start by reassuring healthcare professionals that there's nothing to be afraid of. Many of them are stuck in this archaic mindset. They're fearful of one thing in particular. Can you take any guesses? Picture maybe a teenage boy or girl with a hoodie on, in a corner, typing away fervently at a laptop computer. Guesses? Anyone? Hackers. That is right. Oh my God, hackers are going to steal my stuff. Oh my God, hackers are going to try and sell my data on the dark web. Yes, they are. And they're always going to try and do that. But it is important for all industries, particularly healthcare, to realize that we need to invest in security. We need to make the payout for hackers to be on the good side a lot higher than for it is to be on the bad side. Selling your data on the dark web should be worthless if we invest enough money. After all, we don't want a repeat of what happened in May of 2017. In May of 2017, a ransomware by the name of Wannacry 2.0 attacked over 150 countries around the globe. Take a look. These are all of the places that were affected by the Wannacry ransomware. And it went something like this. You'd show up to work, open up your laptop, or log into your PC, and you'd be met by a red screen saying, "Warning, your files have been stolen and are heavily encrypted. Unless you pay a huge ransom in Bitcoin in a very short amount of time, your files would be gone forever." This was scary, and I wasn't even a part of this attack. The attack dominated media headlines for days on end. What to do? What to do? Even if you were able to get that ransom together in that short amount of time, there was no guarantee your files would be returned safely or returned at all, for that matter. Luckily, due to a team of good international hackers, the ransomware was disbanded and everything was okay. But it was a massive scare. We need to think of our transition of healthcare onto the cloud as, say, the construction of an office building. When you're setting out to construct an office building, you hire an architect or a team of architects that synthesize aesthetics and usability. When the architects have finished their job, they give you a blueprint, and you proceed to hire dedicated construction workers. These are our programmers that will work day in and day out to ensure that your building is brought up in the safest and most secure way. When you finish constructing your building, you have security guards and janitors that are there to maintain and protect your building. This would be our IT professionals and general support services in general. You're probably wondering what this all has to do with you. I'm not connected to healthcare, and I'm not connected to IT. I'm sure that you, and everybody in this auditorium has at one point or another interacted with a healthcare professional, be it a doctor, a dentist, an optometrist, a pharmacist, a nurse, or anyone else. Your life has been affected by the healthcare industry. And I think it is very important that you take note. A shift to the cloud means improved efficiency in your treatment, means improved personalized healthcare. Your doctor or dentist or other provider is not sifting through paper records trying to get to know you. Maybe with the tap of a button, they can just import your data so they can cut through all the fluff. .. Communication really has come a long way since the advent of the modern era. However, some industries, particularly healthcare, are still stuck in this Morse code age. I think that we should embrace technology now. Thank you.